have all of our experts ready to go. So we're going to have John Young from OSHA. We're going to have Laura Cronquist from North Dakota Department of Health, Joel Blanchard from Sanford Ahmed, and Nick Jolla from WSI, and they'll be able to answer questions for you. We've already got a couple of questions in the queue, but definitely if there's additional questions for our subject matter experts that you can think of, now would be the time to send those in to the moderator. So one of the things we want you to consider is the communication that management is sending to your employees at this time. John talked about, the importance of the changes in policies and procedures and all of those things that it's important to communicate. And by the way, OSHA requires us to do that. But the other thing we want you to think about is simply the impact that you can have on overall morale with management communicating to them, to your employees at this moment in time, that safety of their employees and or their customers is their top priority right now. One of the courses that we teach here at the North Dakota Safety Council is a course on safety culture and how to build and improve a safety culture of a company or an organization. And in that class, we talk about that one of the key elements is the management commitment to safety. In fact, we kind of go through this wheel, if you will, and at the top of that wheel is that commitment, because it's really, really hard for an organization to improve and to make positive change if the employees in the organization don't know or are not aware that management is committed to that. So if there is ever a time when that communication needs to take place, that, your safety is our top priority, it really is now. We want to continue to protect our most valuable resource, which is our people. So a few things to consider, and why we are putting this in this point of the presentation is because these are things that even when we hit phase 3 of the federal guidelines, when we're kind of almost all back to a normal situation as far as COVID-19, there are some things that we can do that are simply going to be ongoing mitigations that can protect our people in the future. And one of them is, if you have high-risk employees, we're talking about people with exposures based on illness, based on age, maybe they have multiple types of different illnesses, and they have the ability to do their job from home, we should try to come up with a system where we allow that to occur, because we are going to mitigate their exposure to risk. Next is, as much as possible, let's not bring large groups of people in small spaces if we don't have to. If we're going to bring a training together, for example, for 50 employees, okay, we can do that, but let's make sure that we have the proper space in whatever venue we're doing, that we can have that social distancing. We're going to make sure that, anybody that we invite in has proper social distancing. We want to monitor doorways, and we don't want, a line of people that are standing shoulder to shoulder with each other coming into a room. We want to try to plan ahead for those types of things to, again, mitigate that exposure. And here's the thing. Every year we have a flu season. We have influenza A, influenza B. And all of these protective or advanced mitigations that we can take now, even if COVID-19 completely goes away, we're going to have an impact, a positive impact on our workforce, because fewer people are going to get sick. So these are things that we can continue to practice. And keep in-person meetings to small groups if you can. And you know what? If you can use electronic means to have meetings with people, and you've kind of switched to that now, and you have the ability to continue to do that, again, that's an ongoing mitigation effort that's going to protect our people. So if you have any additional questions that things that you come, even if it's a day or two down the road, and man, I wanted to ask this, but I didn't remember at the time, please reach out to John or myself. If we don't know the answer, we will find the answer. And to remember, those type 1, type 2, type 3, and type 4 business checklists are out there, as well as the North Dakota Department of Health COVID-19 assessment. These are all things that are going to make this reopening process for you better, more efficient, and mitigate or lower your risk. So what we're going to do now is we're going to open up the floor to our subject matter experts. And we are going to start with who, John?
I think we're going to start off with Laura Quanquist from the North Dakota Department of Health. And Laura, if you're there, I'll just have you introduce yourself. If people have questions specific to the North Dakota Department of Health, and I think we had one earlier relating to travel that we'll get to Laura. But if you want to introduce yourself, and then Lisa, we'll see if you have any questions on your side for Lisa. So go ahead, Laura.
Sure. Thanks for having me on. My video appears to not be working, and I'm not sure why. So that was a waste of makeup today. But thank you for having me on again. I work for the North Dakota Department of Health as an epidemiologist. So my normal job entails surveillance for enteric, zoonotic, and vector-borne diseases, but I've been tasked with being the business subject matter expert for our coronavirus response. We do have some great resources out on the North Dakota Department of Health website, as well as the ND Response website. So please check that out if you're able. I believe John and Don talked about our workplace assessment tool, which we strongly recommend that all businesses complete. And we also have guidance for reopening. So the North Dakota Smart Restart Phase 1 guidance is also available on our website. And with that, I will take any questions.
Lisa, do you have any questions specific to the Department of Health?
I believe this one would go to her. Are we able to require employees to declare their personal travel?
You can ask about personal travel right now. I'm not sure exactly where the legality of that falls, but I do know that is a question that employers may ask at this time.
That's the only one I've got.
Okay. One more for you, Laura. And this came from Jay Mordini earlier in the presentation today. Is there a place for people to get tested if people choose to see if they are positive with no symptoms? And I kind of mentioned the mass testing sites that you guys have been doing across the state. Who can show up to those? What do they need to know before they get there? If you want to take that one on, Laura.
Sure. Yeah. For the most part, healthcare providers haven't been testing asymptomatic individuals. If you're a close contact to a confirmed case and you have concerns that you may have been infected, I would reach out to your healthcare provider if a testing event is not available in your area. But I'm glad that you mentioned our testing events. We've been having them throughout the state. Most recently, we had one in Fargo and one in Bismarck. So keep an eye out on your local health department's Facebook page or website for information about that. We also try to update the North Dakota Department of Health Facebook page with testing event information. It just changes so rapidly that it's difficult to find all of that information in one place. But if you do have questions about whether or not there's a testing event in your community that's coming up, please give us a call on our hotline. The number is 1-866-207-2880. Again, that's 1-866-207-2880. And at those events, you do not need to have symptoms to be tested. We will test asymptomatic individuals.
Fantastic. Couple more questions here, Laura. Are there still going to be restrictions on international travel in the next few months?
That's kind of a tough question. I don't want to speculate, but at the same time, I don't see those travel restrictions being lifted anytime soon. And just for the record, our travel quarantine order in North Dakota has not yet been lifted. There has been talk about lifting it later this month, but we haven't been given a specific date. So even as far as domestic travel within the United States, people are still being quarantined. So I guess the long answer to that, the short answer to that would be no, I don't believe that travel restrictions will be lifted. Okay.
Got a couple more questions for you coming in here. While we're on the topic of travel, there is currently a 14-day quarantine requirement after returning from out-of-state travel. Is there an expiration date on that travel order?
At this time, there's not an expiration date on that. We're reviewing the data as it comes in, going with our North Dakota Smart Restart, and we're seeing what kind of impact it will have on our community and on the number of cases to reopen some of these businesses that were previously closed, like restaurants, bars, hair salons, things like that. Once the data has been reviewed, I believe the governor will make a decision based on the number of cases, the amount of community spread, and certain other criteria, especially the availability of testing will play into that also. So know that travel quarantine has not been lifted, and I don't have any specific date for that the rescinding of that quarantine order.
Okay. This next question is from Troy, and this might be for Laura. It might be a little bit for you too, Dr. Blanchard. They want us. We had talked about doing the health screenings for visitors to our building as well as staff, and Troy wants us to elaborate on employee health screening. Is it protected by HIPAA? And what if an employee declines to complete that form? And then he wants this kind of in the context of protecting his critical infrastructure.
Laura, do you want me to take that? This is Dr. Blanchard.
Yeah, that'd be great.
Okay. So companies have to be careful with any information that they acquire from individuals because it is protected health information. So the best advice I can give to people is to just ask the questions and make a decision on the spot and not record any of this information. And if you do, it has to be stored so that it remains completely confidential because that information is protected. In terms of what you do with an individual who refuses to answer the questions or have their temperature taken, that depends on your company policy. If that's a requirement to go to work, then you need to follow your policy. If you don't have a definite policy, you should create one and then educate your employees on it so that they know that if they don't follow through with this, that they won't be allowed to enter the building.
Excellent. Thank you, Dr. Blanchard. Another question might be for a little bit for Laura, a little bit for you, is how does a company request testing for their workforce? If a company wanted to have their staff tested, is there a pathway for people to do that?
Yes, there is. We can't guarantee testing for each company that requests testing, but you can reach out to us. Please call our main disease control number. That's 1-701-328-2378. Again, that's 1-701-328-2378. And just explain that you'd like to request testing for your company.
Great, thank you. Lisa, do you have any other questions there for Laura at the health department?
I do not.
Okay. Got a couple more here. John Young, I've got a question for you. Can you have the OSHA rep confirm the employer is responsible to pay for medical evaluation of an employee who chooses to voluntarily wear a respirator? Could the employer direct the employee that they are not allowed to wear one voluntarily?
Okay, that is a very difficult question, and there's a lot more required for that answer to be appropriate. I'd encourage that individual to call us at 701-250-4521. You've got a couple of things at play in here. First, does the company have a respiratory protection program, number one? Number two, does the employee really need to wear a respirator, which puts cardiac stress like an N95 or higher, or are we talking a face mask, which does not? So there's a lot more to that question than a fairly generic answer. So I'd appreciate it if that person would give us a call.
Thanks, John. Could I get you to just to repeat that phone number again?
Yes, and since I've got the floor here for a second, 701-250-4521 for any questions related to the OSHA standards. You can call at any time. We will do our best to answer them. But for everybody out there, Laura's group has done an incredible job of assisting companies in coming up with the right how-to protocols to protect their employees related to COVID. Our standards under 1910 and 1926, and specifically 1910 132D1, talks about the employer doing the hazard assessment, determining what personal protective equipment and administrative controls are required in their work environment, and the state has done an excellent job doing that for you. If you follow their guidance, for the most part, you're going to be playing in the right ball field as it relates to COVID. Laura, that was kind of a emphasis to you guys, and thank you.
Thanks, John. Lisa, do you have questions on your end?
I do not.
All right. Angie, I've got your question here. Dr. Blanchard, I know you're busy. Do you want to spend a little bit of time talking about the antigen antibody piece of this, that common question on getting tested for antibodies?
Yes, I sure can. So I've been spending a lot of time reviewing testing in terms of return to work and safety at work. And I just have a couple of comments. So I've had companies request, can you check everybody in my company? And I know that the state can do that on a case by case basis. But there's some value to it in seeing how many of your staff are infected at the time. And of course, there's a lot of good from that. But you have to realize that if you test someone today, or let's say I tested someone yesterday at 4 p.m., and I tested them today, they could have come into contact with someone and be positive today. So the duration of a negative test is not weeks. It could be a day. Okay. So there's some limited value of that, except just knowing the status of your employees. And the other one that I'd really hoped to be able to say that antibody testing at the present time will solve a lot of problems, because generally speaking, if, for instance, I always use German measles or rubella as an example. If you contract the disease or you get immunization, you measure a blood test and it says, yes, you're immune to rubella, or no, you're not. Okay. Well, unfortunately, the testing of antibodies for COVID was just kind of rushed through, and we don't know if it's reliable. In fact, there's a lot of evidence stating that there's a lot of false positives. And what a false positive in this respect means is that you do a blood test and it says you have an antibody to COVID. So generally, it should mean that you're protected from it. But unfortunately, these tests are not specific enough for us to say that. And in fact, a lot of the tests, they're only correct 38% of the time. So if it says I have an antibody 38% of the time that's correct, but 62% of the time it's incorrect. So the antibody testing is more of value for research and for populations, and it really should not be used to determine if a specific individual is immune to COVID and therefore is not at threat for getting this infection in the future. I wish I could say that that's it. That was my hope when we first went at this, and I'm hoping that in the next few weeks to several months that we can say that, but at the present time, we cannot. So the other thing that there's some concerns about is we don't know for sure if the antibody that we're testing is specific to COVID, because it's a coronavirus. Colds are caused by coronavirus. So is the antibody, did it go up because you had a cold or because you had COVID? And we think it's from COVID, but we don't know that for sure yet. So antibody testing is really not a reliable method to use to evaluate your employees. So that's why we're relying on temperature checks, a wellness questionnaire when someone comes to work. That is more valuable than the actual antibody testing.
Thanks, Dr. Blanchard. Angie has a question, and again, Laura, this might be for you. Her question is, do you have any tips for maintaining confidentiality in the workplace if someone tests positive and you have a very small staff? Likewise, Laura, in the event that an employee tests positive for COVID-19, they've been active in the workplace, what role does the Department of Health have in doing those notifications within a workplace?
Okay, I'm just taking notes to make sure that I catch all of these. So as far as confidentiality goes, HIPAA is for healthcare providers and healthcare facilities, but the Americans with Disabilities Act is specifically for confidentiality in other types of businesses. So whatever you do, you have to maintain confidentiality according to the ADA, unless, of course, you're a healthcare provider or healthcare facility, and then you have to abide by HIPAA. As far as maintaining confidentiality in a small workplace, that definitely can be difficult. The North Dakota Department of Health does investigate all confirmed cases. We also investigate probable cases. So those are symptomatic individuals who had close contact with a lab-confirmed case. And we do ask about any close contacts. Our definition of close contacts is anyone who is within 6 feet of a person for 10 minutes or longer. We try to get that information from the case. We also work with the workplace for notifications about any positive cases. When we do our case investigations, we ask the individual whether or not it's okay to share their name with their employer and with their coworkers. It certainly makes our job a lot easier when we're notifying close contacts if we can use the name of the person who tested positive. Now that doesn't always happen, and which is fine. That's absolutely okay. If you're not comfortable with us sharing your name and your information, we understand. And so then it's a little bit more difficult to identify who the close contacts are, and we might cast a wider net just to make sure that we're catching anybody who may have been a close contact of that person. But the state health department and people working on our behalf as case investigators do reach out to close contacts to notify them of the date of their last exposure and what their quarantine period entails. So I hope that answered all parts of your question. If it didn't, feel free to reach out to me, please.
I think that was great. Dr. Blanchard, I think this is in follow-up to your comment about German measles and scarlet fever and whatnot. Questions from Rebecca. So if somebody who has had German measles may have an antibody, ? What about scarlet or yellow fever?
Okay. So rubella, yes. Yellow fever, you can measure immunity. Scarlet fever is generally caused from a strep infection, scarlatina. And so I'm not aware of an antibody testing for that.
Great, thank you. Laura, can you clarify, even during our presentation today, we talked about the exposure being defined as 6 feet or less for a duration of 10 to 15 minutes. I think some of the stuff that's been out there was 15 minutes, and you had just mentioned 10. Have there been changes to that guideline?
There certainly have been changes to that guideline, and it has been a little frustrating. So right now we are using anybody who is within 6 feet for 10 minutes or longer as the criteria for our close contacts. Previously, the duration of time was different and the distance between people was different, but I don't foresee that changing again. I believe we're just going to stay with 6 feet for 10 minutes or longer.
Very good. Thank you for that clarification. Again, this one might be for Dr. Blanchard. It might be for Laura. A question about pregnancy. Morgan asks that there's very little information regarding how COVID-19 affects pregnant people. The CDC says there is not enough accurate information to create recommendations beyond the normal precautions. However, other resources say that employees who are pregnant should stay home until delivery. Are there any other recommendations out there on creating a safe environment for our pregnant employees?
I can tackle that one here, Joel Blanchard. So again, there's no specific evidence that COVID-19 is especially dangerous for pregnant women. However, we know that we want to protect pregnant women as much as possible because of the fact that any illness can have an adverse effect on pregnancy. So the CDC basically has advised that we should take all precautions possible to prevent pregnant women from contracting COVID-19. And so it's more of just of a general recommendations and to be extra careful, although there's not evidence that it has a specific, more significant effect on pregnant women. Just in the latter part of a pregnancy, because of the enlarging fetus, there's some effect on the respiratory system because you can't take as big a breath because of all the space has been taken up by the fetus. And so that makes someone just at high risk for multiple respiratory infections. And so that's why there's the recommendation that later on in the pregnancy that it is better to not have pregnant women exposed to people who could potentially have COVID-19.
Thank you, Dr. Blanchard.
Just to add on to that,
Yep.
I'm not sure if people are really interested in the nuts and bolts of epidemiology, but we are doing focused surveillance on pregnant women and neonates. So we are working to better this data and to better our recommendations based on this data.
So, Dr. Blanchard and Laura, do you think that as a general, based on what both of you described, if I'm an employer and I have an employee that's pregnant, if that employee has the ability, based on their job, to work from home during the pregnancy, during the pandemic, that would be a good safety step for them to implement. Would you agree?
I would agree with that.
I would too.
Excellent, thank you. Lisa, do you have questions on your end for either Dr. Blanchard or Laura? I know they're two really busy people. If we can.
Yep, I got one quick one, and I'm guessing it's probably more towards Laura. Becky would like to know if an employee states their spouse tested positive and we have them quarantined for 14 days, should we get documentation about the spouse's positive test or just take employee at their word?
Actually, we could not give you documentation for their spouse. We can provide a letter stating that the employee themselves is on home quarantine. And if your company would like that, please request that from your employee. We would be more than happy to provide that. But as far as providing any test result information, we couldn't provide that for your employee or for the spouse. I hope that makes sense.
Absolutely. That's a really good question right there. Any more questions from your end, Lisa?
Nope, that was the only one.
All right. Troy had a quick question here. Any recommendations on shared restrooms for employees and contractors regarding COVID-19 transmittal? Again, Troy, I alluded to that a little bit in the presentation to, maybe limiting, if it's a very small bathroom, limiting the number of people that we allow into that bathroom to 1 or 2, depending on being able to maintain that 6 feet of social distancing. And then as well as, spacing out urinals, maybe taking some out of service to make sure that we maintain that social distance, and then making sure that obviously we have plenty of soap and water in there.
Yeah, and probably another is if we've got porta potties out on a construction site or something like that, employees are going in and using those. Typically the only cleaning that's done with those is the contractor that dropped them off, and sometimes that's can go longer than a 24-hour period. So I think one of the procedures we would have to consider is getting somebody assigned, based on how often it's used and how many we have. We may have to go in and disinfect those on a regular basis throughout the day, depending on how much they're being used.
All right, very good. If there's no other questions for Dr. Blanchard or Laura, we want to thank you two, especially for your time. I know you guys are incredibly busy with your jobs. If people have questions specific for those people and they didn't get a chance to get them in today, feel free to email Don or myself, and we'll get those answers for you and get back to you with those. Laura or Dr. Blanchard, do you guys have anything else you want to add that you're seeing on the front lines?
No. Thank you for your time, everybody.
Thank you. Laura, do you have anything else you need to add?
Nothing specific, no, but thanks so much for having these webinars. These are great, and we really appreciate being involved. So please share my contact information. I'd be more than happy to answer any questions. Thank you again.
Great, thank you. I know the watchers really enjoy getting answers straight from you guys, so fantastic stuff. Thank you.
Thank you.
Nick Jolliffe is also present with us, and Nick is with WSI, Workforce Safety Insurance. If anybody has questions specific to COVID-19 as an illness and how that relates to workers' compensation and what's reportable, things like that, feel free to send those in. Nick, if you want to give us just a quick synopsis of what you're seeing from your guys' end, kind of the common questions, answers that you guys are going through, that would be great.
Thanks, John. Appreciate it. And I want to echo what Laura was saying. I appreciate everything the North Dakota Safety Council and OSHA and Department of Health and Dr. Blanchard has done to provide these informational sessions. John and Don have done a great job of providing great information in a short period of time, especially when that information seems to be changing daily. So again, we appreciate the partnership that we have with everybody. And we would just like to state that WSI is available as one of the resources, along with OSHA and the Safety Council, Department of Health, as a resource to provide information or consultation services to help these employers to bring back workers during this reopening period. WSI is currently, like a lot of folks, working remotely. All of our safety consultants and our loss control staff are working from home and currently doing all of our business by telecommuting. We are currently awaiting a directive from the governor's office and from our director, Brian Klipfeld, as to the possibilities of our field staff getting back out into the field and being able to conduct some one-on-one consultations for some of these employers. A lot of what WSI is involved with right now in the COVID-19 is questions regarding how to bring these folks back to work safely. What are some of the ramifications if we don't? And so we try to address those. But I'd like to point out that we have a lot of information on our website at workforcesafety.com as it pertains to information for the employers. This COVID-19 response has changed quite a bit of the reporting requirements during the crisis. There's been some changes there that are a little bit more beneficial to reporting requirements for our employers. So they can go onto our website and pull up a PDF with frequently asked questions in that area. We also have a section on information for employees. When COVID-19 first started out, by statute, COVID-19 is considered an infectious disease that is common to the general public. And by statute, it is not a disease that is covered by workers' compensation. However, through an executive order from the governor, there has been some exceptions made, and that's currently for frontline healthcare workers, first responders, and those folks involved in the funeral industry, that there is exceptions made for those. So there is information out there for those types of employees that may have questions. That information is out there. And also there's a section in a frequently asked questions section for information on providers pertaining to some of these things that are covered from employees. Some of the pre-authorization and things like that providers have to go through WSI have changed a little bit during this crisis. So they can look for that information, or at any time, if anybody has any questions regarding workers' compensation and workforce safety insurance response to this, they can contact us at this telephone number, and I'll say it twice here. It's 1-800-777-5033. Again, that number is 1-800-777-5033. Or they can email us with any questions that they have at ndwsi@nd.gov. And somebody will be in touch with you and get you in touch with the appropriate resources to hopefully answer your questions. But real short, what the safety consultants are doing, if you are a participant in any of our safety incentive programs, you can contact your assigned safety consultant directly, and they should be able to assist you in all of your questions regarding safety-related issues in bringing these folks back to work. If they don't have the answers, again, between all the resources that we have with the Safety Council and OSHA and Department of Health, we're confident that we can find the resource that will be available to assist you. If you're not a participant in any of our safety incentive programs, again, you can by all means contact us at our 1-800 number or that email address. And again, we'll do our best to assist you. Right now, it'll be through a telecommute or a teleconference or any other means that we can to try to reach out to you. But it is our goal to make sure that all of the policyholders in North Dakota know that there are resources available. A lot of times we hear, concern that there's just not the resources. And between the Safety Council, OSHA, Department of Health, Workforce Safety and Insurance, we feel that there's an abundance of resources there, and we are here to do what we need to do to make our employers feel confident that they know what's going on in the area of safety as in this reopening as it changes daily.
Thank you, Nick. Lisa, do you have any additional questions that have come in for either Nick or John?
Not at this time.
Okay. And Nick or John, whichever one of you want to tackle this question. So we have an employee or a group of employees that voluntarily wears cloth masks into the workplace, what, if any, requirements does that place on the employer?
If it's a cloth mask, this is John speaking, none. The only question I would ask for the employer, and again, I don't know the industry, is that following the SMART guidelines. Many of the industries, the employees are supposed to be wearing cloth masks. So I just asked them to take a look at the guidelines for the industry they're in.
Thank you, John. And then, John, could you speak to, and of course we touch on it a little bit in the webinar, but could you just kind of give us an overview of the respiratory protection requirements, and the difference between the K95 and the types of, and the hazard assessment and everything that goes with that, so that everybody has a clear understanding of the differences for us?
Sure. So part of the difference is the employer is required by the OSHA standards to go out and evaluate the hazards that their employees may be exposed to. Now, that's exposure between employees, and that can also be exposure from outside to the employees. From that determination, they're supposed to identify the appropriate personal protective equipment and or training and or administrative controls to protect their employees. There's another section which also covers cleanliness. That's in 141, if anybody's curious. For those in the medical field, it ties over into bloodborne pathogens and into that area. And there's a few other outlying standards, and you mentioned respiratory. If you determine that your employees are required to use an N95 or greater, then that throws you into the respiratory protection program. Not all businesses would have a need for N95s. Now, I bring this up because many people have heard N95s and their first instinct is we have to get N95s. If you're presumptive, say a first responder or in the medical field in a hospital, an N95 would be expected because that N95 is protecting you from absorbing, through your respiratory system, virus. Okay. It's not necessarily stopping you from spreading the virus depending on the type of mask you have, because if you've got the one with the outlet on the front with a little circle, every time you exhale, it goes straight out. A mask, on the other hand, it provides some inhalation protection, but it predominantly stops droplets that you have from going to other people. Masks don't have a respiratory requirement related to cardiac stress, such as an N95 would. So, I caution employers. I know many employers immediately say we have to have an N95. If you think that's the case or you are uncertain, please reach out and call us or call Nick's guys. We'll coach you through on, is an N95 really what you need, or do you need masks?
Okay, thank you, John. Lisa, do you have any additional questions for OSHA or WSI?
I do not.
Okay, we're going to wrap
Don?
things up here. Yeah, go ahead, Nick.
Don, I just have one quick comment, and hopefully John will chime in here too. And it's a point that we've received already a couple inquiries, and we're anticipating that we're going to receive more. And it goes along the lines of an employee contacting us and to report that their employer is not following the guidelines that are set forth as far as reopening. And what can they or should they be doing about it? And our response from a WSI perspective is that, if you have an employer that is not, following the guidelines for the reopening, by all means, we hope that employee would have a conversation with that employer. But then after that, by all means, they can contact us, and we will see exactly what type of issue it is. But when it comes to the side of compliance, we at WSI take more of a role of a consultation role, and leave the area of compliance more up to John and OSHA. So, John, would you have any comments on that? As if they were to contact you, what might be the response?
Thanks, Nick. Yes, we would respond like we do for any other complaint that we receive by employees. We will do something. It may be a phone fax, or we have the capability to do an on-site inspection. So you're absolutely right. Again, we are an enforcement agency, but we also do assistance when asked. So if employers are asking us, we'll tell you everything we can to help you get up and running. But when a complaint comes in, it's the employee's right. We will treat it no different than any other complaint, because I think everybody at this point knows OSHA has applicable standards that may kick in for COVID hazards. And Nick, you brought something else up, and the previous two sessions we talked about it. So I'm going to throw one back to you: the recording versus reporting. So Nick had mentioned that it may not be necessarily something work comp does, but OSHA's recording requirements are different than workforce safety and insurance.
Right.
So if you do have an employee that's exposed or hospitalized and it's work related or occurred at the work environment, please remember that the OSHA standards are still in place. Even though you may not necessarily go over to Nick's group, our stuff still requires it to be recordable and or reportable, depending on. I think I cut out there, didn't I?
Just at the end there a little bit.
Yeah. The last part I was saying before my mic went off is, in the event that we are different, if it meets the OSHA requirements for reportability and recordability, it's still in effect. And COVID, unlike the state, is identified as different than the flu. So those of you who are looking at your 300 logs and are thinking this is a flu, check our website. We specifically say in their pandemic, this does not apply. So.
Okay. Thank you both again for joining us in the clarification. Yeah, go ahead, Lisa.
I'm sorry. I did have one question just pop up here. Rob would like to know what precautions are compliance officers at OSHA taking during worksite visits?
That is a very good question. The compliance officer will use a concept of distance. We'll also use masks. We may use respirators. Our compliance officers, when they go out, kind of evaluate the hazard based on the conditions that they see. They have a full kit of from Tyvek suits to all sorts of respirator equipment, but it'll based on what they see in the environment out there and how they go about it. Many times what we're using when it's outside is distance with a mask. Inside, we have to evaluate it. If you have a program and we show up at your location, just like on any other work site, we expect the employer to share their COVID program with us to make sure that we're doing it in accordance with what you want. I hope that helps answer that question.
Thank you, John. And we did have another question that came in, and this is for, I think, both you and Nick. How could anyone substantially prove that they had acquired COVID-19 at work, and therefore then that becomes a OSHA recordable? So I think I see that as two parts, right? How would they prove that, where they contracted it? And then if they are able to prove that they contracted it at work, what are the OSHA recordable requirements?
Okay, let's walk down what we would call the presumptive cases, and Nick alluded to that earlier. If you're working in the healthcare field, as an example, you're an ER nurse, an emergency room nurse, or you're the person taking CNA who's taking care of COVID patients, my challenge back to you is prove they didn't get it at work, okay? If you're outside of that environment, then that's a different scenario, and it's a lot more tricky. We're going to ask the employer to make a reasonable investigation of their workplace and say, is this possible that it came from work, or was it social from outside? Just like we would any other condition. But it's basically doing their own investigation to the best of their ability to make that determination. I'll use the scenario of a hospital employee who's working with COVID patients, who then comes down with it. If they are at work and they wind up getting admitted, they have the same 24-hour reporting requirement. In the event they would pass away, which I hope does not happen for anybody in the work environment with COVID, that would also be reportable within 8 hours. Outside of that presumptive, and I think it's very similar, Nick said the governor signed that for those presumptive responders. It's a little more tricky in that manufacturing environment to prove where it came from and how the outbreak may have spread. If you get into that scenario, call us and we'll try to ask you a series of questions to coach you through it. That would probably be best. Did I get that right, Nick?
You pretty much nailed everything I would be thinking of, John.
Okay. I think that, Lisa, do you have any other questions that have come in on your end?
I do not.
Okay. So thank you, John, and thank you, Nick, again for taking time to join us. And just to make sure, would both of you please just do your contact numbers one last time for our group?
Okay, here at Workforce Safety and Insurance, our contact numbers are 1-800-777-5033, and that will get you in contact with a customer service rep. And as I said, if you're a part of our safety incentive program, you can contact your safety consultant directly, or you can contact us at email ndwsi@nd.gov, and somebody will respond with you in a short period of time.
Thank you, Nick. And John, could you do your number one last time, please?
701-250-4521 will get you straight to our duty officer. We have a duty officer on who's willing and able to answer your questions, and if they can't handle it, they call me. And somebody had asked, or Nick had brought up about being in the field. Our people are in the field in limited abilities right now. We're doing a lot of, I guess, guidance, question answering at this point, but we are in the field.
Okay, thank you both again for making time for us and our attendees today. Just a couple of final things before we wrap up. Remember to utilize your business type checklists. And again, if you didn't receive one via email, you can download those off our website at ndsc.org. We also had a couple people ask questions about will there be a recording of this session available? The answer is yes. And we're hoping to have that up and running and available sometime probably toward the end of the week. And there's likely going to be an email sent out to all the people that attended, letting you know that now is available. And finally, we would love to have your feedback. So please download this QR code and fill out the evaluation and give us some feedback on our session. And again, additional questions, we're going to leave the session open. If there's any additional chat questions for either John or myself that you want to send to us, and you can follow up via email to either one of us, and we will certainly try to answer anything and everything that we can as we all try to bring people back, bring customers back, bring workers back, and do it in a safe and responsible manner. So thank you all again for your participation. And we wish everybody a very, very safe week. And let's work together to make North Dakota, the safest it can be in the midst of COVID-19. So thank you all again.